Okay, so we are going to look at pharmacotherapeutics. So this looks at like the medications, the administration, how to write a prescription, and all that. Because it is so broad, I have divided it into smaller chunks so that it's easier to read and it doesn't become so boring when you're reading. Okay, so definition of pharmacotherapeutics is the use of drugs to treat disease. I mean, the import of doing pharmacology is to be able to prescribe medication for our patients. And so the pharmacotherapeutics is like the central theme to enable us to do this. So when choosing a drug to treat a particular condition of the patient, you need to consider not only the drug's effectiveness, but other factors. As we go on in pediatrics, in internal medicine, in surgery, you will also come across medications that are used to treat the various conditions. So in addition to learning about the condition, you will also learn about the medications that are used. And when you want to choose a particular medication, it's not just choosing based on the fact that, oh, this drug is good or this drug is effective. You also need to consider other factors. So examples are the type of therapy that the patient will receive. If the patient is receiving intravenous therapy, for example, there are some medications that cannot be given intravenously. And so you may need to consider other alternatives, even though the particular drug you are considering is very effective. Then you also need to consider the severity of the condition. Medications have different efficacies. And so if the patient has a very severe condition, you might consider one drug over the other. So for example, a patient in pain, you ask the patient to grade the pain and they tell you that the pain is 10/10. That's the most severe kind of pain they've ever been. So in choosing medications, you have two analgesics. Because the pain is severe, you would choose, let's say, the higher analgesic. So let's say morphine instead of paracetamol because of the severity of the condition. Then you also need to consider the urgency. If the patient needs to be urgently given that particular medication, then you might want to consider a medication that can be given through an urgent route. So for example, intravenous route or intramuscular route compared to oral route. And of course, the prognosis of the condition. If it is such that nothing much can be done, then what you are doing is just to keep the patient comfortable. So in that case, you don't really need to go to the most effective or the most expensive or the most efficient medication. So we look at the types of therapy that are available. We have acute therapy. So if the patient is critically ill and requires intensive therapy, then you resort to acute therapy. We also have empiric therapy. So empiric therapy, for example, antibiotics. So empiric therapy is based on practical experience rather than on pure scientific data. So for example, patient has an infection and you want to treat with antibiotics. Let's say neonatal sepsis, you want to treat with antibiotics. So experience has showed you that penicillin and gentamicin work very well. But you will take a blood sample for will not come that day. So you start the patient on penicillin and gentamicin whilst you wait for your results, which may come maybe after 48 hours. That's the earliest. So that penicillin and gentamicin that you gave is empiric therapy. It's not based on scientific data, but it's based on practical experience. Okay. Then we also have maintenance therapy for patients with chronic conditions that don't resolve. So an example is hypertension. With hypertension or let's say diabetes, the condition is not going to resolve. You are not going to have the patient cured from hypertension. So this antihypertensive that you are giving is a maintenance therapy for the patient. Okay. Then we have supplemental or replacement therapy, and this is used to replenish or substitute for missing substances in the body. So, for example, you are giving IV fluids, and because the patient is having diarrhea and vomiting. So, ordinarily, because of the diarrhea and vomiting, the patient is losing electrolytes. The patient is losing fluid. So, you are replacing it with your intravenous fluid. It is not really curing a disease. It is supplemental or replacement therapy. Sorry, please excuse me. Hello, Nanama. Hi, good afternoon.
Afternoon.
I'm giving a lecture. No, it's on Zoom. It's on Zoom. It's in your fear. Mo pese mo ba na.
Hi.
I forgot to tell you, it could be a reaction from the medication. But what the if you are home, you can bring him in and
Hi, me person.
oh, in the next 15 minutes.
Oh, wow, I bet you.
Okay. And I'm sending you a Google Maps location. All right. Okay. And then many locations it here. Hey, Pashiga, mute your microphone.
Pashiga, so ewe.
Oh, you do microphone, Miss Ade. You are getting.
But I'm sorry, why? Sorry.
Yeah. I'm supposed to send a Google Maps location. Okay, messaging later. So the types of therapy, we have supportive therapy. So for supportive therapy, it is therapy which doesn't treat the disease, but it maintains other threatening body systems until the patient's condition resolves. So let me give an example. A patient with leukemia, cancer of the blood. Now, this patient will present with anemia. They will have decreased white blood cells. Their platelets will be low. So for such a patient, supportive therapy would include giving blood transfusion, giving them platelet transfusion, and then giving IV immunoglobulin because of the decreased white blood cell. So this blood transfusion and platelet transfusion, it doesn't cure the leukemia. It is supportive, trying to support the body as you give the medication for the leukemia until the body is able to come back to its normal state to resolve whatever underlying condition there is. There is also palliative therapy. Palliative therapy is just used for end stage or terminal diseases, just to make the patient comfortable. So a patient with a terminal condition, let's say cancer of wherever, and the patient is in severe pain, the cancer cannot be cured. Patients would definitely pass. But you are giving, let's say, morphine to try and bring the pain down. The morphine is not curative. The morphine is not supportive. The morphine is just to make the patient comfortable. I hope we get the difference between all these types of therapy. Now let's look at the patient's response to a drug. So a patient's overall health as well as other individual factors can alter the patient's response to a drug. So certain medical conditions or the lifestyle of the patient should also be considered when selecting drug therapy. So decreased response to the drug can occur when the patient develops a tolerance to the drug. So let's say you used to give 5 milligrams of morphine and it will reduce the pain in the patient. Now, as time goes on, you have to give 10 milligrams. So it's like with time, the patient requires larger doses to produce the same effect in the patient. And this brings us to tolerance. So tolerance is a situation whereby the patient's sort of gets used to the medication. But drug dependence means that the patient displays a physical or psychological need for the drug. This is where addiction comes in. So physical dependence produces withdrawal symptoms when the drug is stopped. And psychological dependence is based on the desire to continue taking the drug because of the effects that the drug will produce. So for example, if you have a pethidine addiction, oh, sweetie, I'm still teaching. What's up?
Wow.
Are you driving?
Something like that.
All right, dear. Bye. So why are you calling me when you're driving? Just won't see my face.
Some more.
Hey,
Well,
madam.
Madam, my head, Madam is a
Some
human
more.
being, like all of you.
Hey, madam.
I'm alive.
Okay, so time is even almost up. So, because no two people are alike, physiologically or psychologically, the response of the patient to the drug can vary. And it's based on so many things. So for example, age, cardiovascular function. If somebody doesn't have a good cardiovascular function, you might want to give another drug in place of what you are thinking of. Diet, underlying disease, for example, renal disease, liver disease, drug interactions. So let's say this patient is already on a certain medication. If you give another medication, because it can interact with that medication, you may want to choose another medication. Then gender is also important. GI function. If let's say a patient has a condition of the GI, let's say gastritis, you can't give NSAIDs, okay? And then underlying infection. So let's look at drug interactions. So drug interaction is the reaction that occurs between the drug and another drug, or between the drug and food. We have 5 minutes. I don't know if I should pause for any questions so that we continue from this point next week.
Oh, madam, continue.
Are there any questions?
No questions.
Madam, continue. Let's use about 10 minutes to wrap up.
Okay. So drug interactions can occur between the drug, or between the drug and another drug, or between the drug and food. And they can also interfere with results of lab tests. So let me give an example. Okay, so if you give sodium bicarbonate to a patient and you take their sodium level might be high. Or if you check the pH might be high because the bicarbonate is alkaline. Sodium bicarbonate is alkaline, so it will cause the blood to become alkaline. And this acidity or alkalinity of the blood can affect the metabolism of certain medications. Also, the more drugs a patient receives, the greater the chances that drug interaction will occur. So usually there is something called the BNF. British National Formulary. It's a book which contains so many medications, their dosages, side effects, and all that. At the back of the book, there is what they call the drug-drug interaction. So if you want to give a medication and the patient is already on a medication, you can check to see if the medication can interact with what you're already given. So potential drug interactions include additive effects. We will explain this as we go on. Then potentiation, antagonistic effect. Antagonistic, we understand, it's opposite.
Madam.
Or,
Okay.
then we also have decreased or increased absorption, and then decreased or increased metabolism. Okay, so let's
Madam.
look at these. Yes.
Please, I have a question.
Okay, go
you,
ahead.
you mentioned like a book. Please, is it the same thing that is being used on up to date? This thing, it's a platform that is used.
Is it the
So
same
if the
book?
person comes and then, yeah, is it the same like kind of technology, or like is it something that is being mimicked? Because there's a software that has the same type of thing for diagnosis or clinician. When you come to the outfit and you're already
it's different.
yes on the
It's different. As for software for diagnosis, there are several. There's Medscape, there's Up to Date, but the BNF is a book. Oh, let me see if I can. I can't find mine readily, but I'll bring it to class and then show it to you. So it's a book.
BMF,
and it has
right?
BNF, yes. It is done, there are editions. So you have several different editions, and that helps you to check quickly at a glance. And it's usually in the consulting rooms because you can't keep all these things in your head. So you just check quickly at a glance, and then it helps you to know what's going on with respect to drug interactions. So, for example, if you give certain medications and you have issues, then when you check, you realize that, oh, okay, this medication is not supposed to be given in people with this condition. And so then it helps you to know that, okay, that's the cause of the patient's situation as they are. Any other questions? Any other questions before we go on? Okay.
Madam, go on, no question.
Okay.
Yeah, madam, is the that you are talking about, does it the drug
No.
and its
No.
receptors?
No, it doesn't.
Biologist,
just
please,
about-
no.
It's just about the medication, the dosage, the formulation, the side effects. Yes.
Hey,
Okay.
biologist.
As for biology, you'll be free.
You kill us, oh.
So the drug interactions, we'll look at them one by one. So additive effects. Additive effects can occur when two drugs with similar actions are administered to a patient. And the effects are equivalent to the sum of either of the drug's effects if it is administered alone in higher doses. So an example is Codamol. There's a medication called Codamol. It is codeine and then paracetamol. And this medication has smaller doses of codeine and smaller doses of paracetamol than you would give. So let's say if you are giving an adult paracetamol, you give 2 tablets. Okay, but the Codamol contains maybe 600 milligrams of paracetamol instead of the 1 gram, and then a smaller dosage of codeine. And the effect is equivalent to administration of either paracetamol or codeine alone in higher doses. So giving the 2 drugs together has several potential advantages. For example, it gives lower doses of each drug. So the potential for side effects is less. And then the patient also gets greater pain control than if they had just gotten one medication. And this is usually because they have different mechanisms of action. Paracetamol acts differently from codeine, but when you give the 2 of them together, their effects add on. And also, there's a decreased risk of side effects because you are giving lower doses of the drug. Okay. Then we have synergistic effect. So synergistic effect is when you give 2 drugs which are producing the same effects, but then one potentiates the action of the other. So it also gives a greater effect, but then the effect is greater than in the additive situation. Here, when you are giving the drugs synergistically, you give each of them in the normal dosage that you give alone. Okay, unlike the additive effect where the doses are smaller, with synergistic effect, the doses are the same, but they are given together and they potentiate the action of each other. So let me give an example. When you want to nebulize a child with asthma, you can give salbutamol alone, and it will achieve the desired effects of bronchodilation. You can also give ipratropium bromide alone, and it can also achieve the same effect. However, if you mix the salbutamol with the ipratropium bromide in the same container and you nebulize, you realize that the patient gets the relief faster. But in this case, you haven't decreased the dosage of the salbutamol or the ipratropium bromide. They are all the same dosage. I don't know if it's understandable. Okay.
Yes, ma'am.
All right. Then we have antagonistic effect. So antagonistic effect occurs when the combined response of the two drugs is less than the response produced by either drug alone. So this is like the opposite of additive. So with antagonistic, when you give the two medications together, it decreases the response. But with additive, it increases the response and the dosage is less. And with synergistic, it potentiates the effect, but the same dosages are given. Then you can also have a situation whereby there's an absorption problem.
Hello,
So
Doc.
two drugs, yes, we have to stop it.
Yeah, I will have to pause here and then. But maybe if within the week we can take
And
time.
continue next week.
Okay. Okay. All right, Doc.
Any questions?
No
Are there
question.
any questions?
No any questions, Doc. No any questions.
Hey, Christian, I was just asking about you. I
Doc, I
can't
just came
believe
from
the 1
BT.
year is almost up.
Oh,
you're
next
coming
2 months.
Hey,
The first shock is coming 7th August.
hey, one of my residents is coming SMO, so I know that they'll be rotating soon. But I'm just amazed that the time has passed so quickly.
Yes, Doc.
What position are you in? Where are you?
5-40. Bravo HQ.
Oh, Bravo Company. Okay,
Yes.
I see. I was in 0 Alpha.
Yeah, okay.
Anyway, since we have to go, have a nice evening.
Doc,
And,
you too. Thank you.
all right. Bye.
Bye, Doc. Bye-bye.
Bye. Good no more.